Hi, all. Thank you all for joining today's live Aspen Health for All conversation. These conversations are part of a larger effort housed at aspenhealthforall.org that is amplifying the important work being done by leaders and innovators all over the world to address the disparities that have been amplified by COVID-19. Our aim is to focus on health equity and connect a range of experts working on the front lines of health around the world as we all pivot to respond to the challenges of COVID-19. We are in search of common solution and shared insights. And as the US reckons with a legacy of racial injustice and the continued systematic oppression of Black lives, we want to take this moment to say that we will not tolerate violence and hatred against Black communities. Our global community stands tall with local leaders, collaborators, healers, and fellows who've long been beacons in this movement and whose voices and work are critical to reshaping a healthy, equitable future for all. Today, the Aspen Global Innovators Group is excited to host a conversation with Aspen New Voices Fellow Harish Sadan, the co-founder and chief functionary of Men Against Violence and Abuse, and Rachel Jones, a contributor for National Geographic magazine, a development media consultant, and a two-time top 10 media writer on LinkedIn. And we're honored that Sarika Bansal will moderate today's session. Sarika is the founder of Honey Guide Media, the editor-in-chief of Bright Magazine. And as a reminder, please feel free to ask questions throughout the session using the Q&A box. And with that, we will pass it over to Sarika.
Hi, everyone. Really nice to be here, and I'm so excited to be having this conversation with all of you today. As Sion said, the topic that we're covering is gender and COVID, which is an enormous topic. I'm confident that our two fantastic panelists will be able to help chip away at it. So just as a short introduction, the coronavirus pandemic has revealed many inequities in society, and certainly that is true with regards to gender. So we've been seeing this throughout every level of society, big and small, from the way that male leaders have championed the pandemic as opposed to how female leaders have championed it. We've seen it in how masculinity has often collided with science. We've seen it in the people who are exposed to the virus by virtue of their profession. And we've even seen it in the way that dynamics have shifted at home. So as I said, this is an enormous topic to be covering in 30 minutes. I'm confident, however, that our two fantastic panelists today will be able to help us make sense of it all a little bit. So as Sion said, we have two panelists. The first is a New Voices fellow named Harish Sadani, who is among India's leading gender rights activists. He is a social worker by training, and for the last 26 years, he's been working to educate men about improving women's sexual and reproductive health. As Sion said, Harish co-founded MAVA, Men Against Violence and Abuse, in 1993 to prevent gender-based violence against women, and also to engage boys and men on healthy relationships, masculinity, and sexuality. Our second panelist is Rachel Jones, who is a freelance journalist. She is a contributor for National Geographic magazine, where she recently wrote a story about women on the front lines against the fight against COVID-19. She's a development media consultant and a two-time top 10 media writer on LinkedIn. She's also reported for NPR, National Public Radio, for the Knight Ridder News Service, and for the Detroit Free Press. So I would love to start with Rachel. My first question is for her regarding leadership. So in your piece for National Geographic, you touched on the virus's disparities in countries that are led by men versus countries that are led by women. And this is something I've been seeing on social media a lot. I would love for you to chat about some of the different qualities of leadership between male and female leaders that you think has led to the differences we're seeing in how much the virus has spread in different countries.
Thank you, Sarika. I would first point to the fact that countries like New Zealand and Germany and Iceland and Norway, which have women leaders, have reported remarkable progress in containing, identifying the virus, and contact tracing. In other words, being able to know who people who have been exposed to coronavirus have interacted with. And so one of the most powerful things I heard during my reporting on this came from the executive director of UNAIDS, Winnie Byanyima, who said that people who've been left on the outside of leadership positions and on strategy and policy development can't help but bring a different perspective, a much more needed perspective, and a better approach really to dealing with things. So that when we think of coronavirus, when we think of the fact that policies that affect families and children, when we think of work hours, labor challenges that come up with the handling of the virus, if you leave out half of the potential pool of people who can come up with solutions, you will see an effect on outcomes and on progress. And also, basic point of view, women are much more collaborative in terms of being willing to ask for the support or bring people to the table to address these kinds of challenges. Whereas sometimes male leaders may feel that they either have the solution or they will only reach out to people that they know and who they are comfortable with when it comes to making those top line decisions. So I think we've learned a lot about the response to coronavirus in terms of what countries lose out on when they don't include women in leadership positions.
Yeah, those are really great points. It reminds me of I recently read an article in Forbes where they reviewed some research that was done on this very topic, where they found these two researchers from the University of Liverpool. They matched every women-led with a woman-led country with a male-led country that had similar GDP, similar population size, and they saw the difference. And in pretty much every country, they said that the response it was unmistakable, that it was these qualities that you're talking about being more collaborative, about thinking, being more risk averse when it comes to losing people's lives. That women-led countries tended to have those qualities that have helped them contain the coronavirus pandemic. And did you see in your research as well about what qualities were in more like alpha male type led countries that led to sort of the opposite response?
Well, I think there's a certain sort of resoluteness in the minds of some male leaders, not all, I don't want to stereotype, but that, depending upon their own vision or their own opinion about these sorts of things, as opposed to, again, being more collaborative, being open to energy from other resources, a sense of, a certitude that I know the best way to do this, as opposed to taking in being open to collaboration. I think that's one of the challenges. But again, women in many ways, in terms of their lives and the way their lives are ordered, are certainly more used to perhaps triaging, pulling from different areas, having a support system that might not be as what people are used to seeing or whatever, but getting the job done, doing whatever it takes to be able to get a result. And so that's the sort of thing that, again, people left out of leadership come up with much more creative ways to deal with problems.
Yeah. Harisha, I'd love to turn to you to chat a little bit about masculinity, because I know that you've been working for so many years on how to dismantle masculinity, or how to just rethink it and reshape it. How have you seen the traditional notions of masculinity colliding with or just interacting with how the coronavirus pandemic has been progressing?
Yes. So, I find that among the markers of the traditional dominant masculinity, one of the markers is related to performance. So, men are supposed to perform, they are supposed to, one of the roles is provider, protector, and always a winner, achiever. These notions we have been growing up with from a younger age. So, a man who has lost job, and, a large number of men would have lost jobs. So, they see themselves failed as a man, as not being provider, so as a result of which, there's a lot of pent up frustrations, and then the anger, which may, result in any form of violence, either to the opposite gender or to self. So those examples, you find in India, where I come from, a large number of suicides.
think Harisha's connection may have frozen a little bit.
Until we can reconnect with him, I'd love to just sort of restate something that he said in one of our preparatory calls, and that the one of the biggest challenges with India. Oh, there
to find that. I'm sorry.
Hi, Harish. Yeah, you're back. You're back. So you were just saying that there's a large number of suicides that have occurred.
I was telling that the styles of leadership also, when you see in countries like India, US or Brazil or UK, you find that there is a sense of narcissism in the leaders at the top. Also utter disregard for science, for simple things like wearing masks or observing, safe distance norms. You find that, so lack of empathy for the marginalized, I find that even the language which is there of these leaders, there is a language of domination. So I find, that masculinity, the traditional notion, is manifested in various forms during these 6 months of pandemic, I could say.
Yeah, and I know, Harish, you've also talked about before, just like how the idea of wearing a mask has somehow morphed into something that's not a masculine thing to do, that the idea of protecting others by giving up a little bit of your own personal freedom by wearing a mask. Has that been something that you've seen in India in your work?
So yeah, so the expectation that the men should be tough, they should not, their role as a protector, as you say.
I feel bad that his connection is dropping. Yeah, that I know that he's talking about how men often have this role that they feel like they have to fulfill as a protector, and that they have to be tough, and that sometimes butts with the idea of being part of a community.
He stated it so beautifully the other day. That India is battling two viruses really now: the patriarchy and coronavirus, and it's coming together in an extremely combustible kind of way.
Yeah. Rachel, I'd love to turn back to you. Harish brought up a little bit about being on the front lines and being exposed to the pandemic and some people losing their jobs. I know that you've done reporting on this and regarding frontline workers and people who are really exposed to the pandemic. Can you talk a little bit about how gender plays a role in that case as well?
Well, the ultimate statistic that we all need to know and be aware of is that 70% of the healthcare provision, be it administrative, front lines, home health care, caring for the elderly, et cetera, is performed by women. And yet only 25% of the leadership is led by women. And so to me, that creates an imbalance in terms of truly not only understanding the needs of the workforce, but also developing programming and policies and strategies that take into consideration different gender roles, different needs of gender, et cetera. There is an organization in, I believe, Geneva that is attempting to do very specific research on the impact in terms of mental health and in terms of childcare on women. But one very powerful example is the fact that when the need emerged for protective equipment, personal protective equipment, and many communities found themselves, reaching into their storerooms to find equipment they'd use for other hazardous events or whatever. But many of the individual pieces or the equipment simply did not fit women. They didn't take into consideration the fact that women's body shapes are different, that they would need a certain access during their menstrual periods. So everything is designed, and again, this is not a discussion that demonizes or says men's participation is not appreciated. It simply highlights the fact that emergency situations, policy development, strategy really doesn't take into consideration that women would bring not only a perspective, but a set of concerns and needs that need to be taken into consideration on the whole.
Yeah, absolutely. And you mentioned that it goes beyond, like, there's the healthcare workers. I think you just mentioned also that a lot of care providers and homes or women, they are some of the least protected people. Like they don't have that many, they don't have a giant hospital chain that's able to provide PPE for
Absolutely.
them.
When you think about nursing homes, when you think about childcare centers, et cetera, there's no budget for these kinds of things. And yet these people are on a day-to-day basis exposed. But ultimately, again, globally, when you think about who's the first person that finds out that coronavirus is in the family, who's the first person who identifies and takes care of the child or the sick husband or the sick whoever, grandparent. So women really are on the front lines across so many different sectors.
Yeah, it's so true. Like people are on the front lines by virtue of the profession. They're also on the front lines at home in many cases as well. Which Harish, that brings me right back to you, because you've done so much work regarding regarding violence against women and men's role in helping dismantle that. I'd love for you to talk about, I mean, now that we've all been stuck at home for so many months, people who aren't on the front lines because of their profession, they are finding themselves at home for, potentially uncomfortable extended periods of time. How have you seen coronavirus changing the home front, and how have you seen any traditional gender dynamics shifting as a result of the pandemic?
Yeah, so on the positive side, there are some instances coming which we see in India where men are, giving time at home. They are contributing to the domestic cause. They are giving some quality time to their children, But again, how long will this go on, in the long run? That has to be studied. But nonetheless, so you find that while this is happening, and it is positive and reassuring, but on the wider scale, if you
It's so bad that Harisha's connection keeps dropping.
No, he's making an excellent point about the issue of, oh, go ahead.
Yeah. Oh, you're back, I think, Harish.
Yeah, so I'm looking at, that a disproportionate amount of burden on, working middle class women is increasing, so you find, and largely the work which is done at home has been invisibilized, unrecognized for years, so what has happened now that domestic helps, who are also largely women, they have been asked to go because of pandemic. So as a result, you find the working women doing all the work at home apart from their job responsibilities, taking care of children. Now that many of the children are at home instead of schools, I'm talking about countries like India. So, it is heavily, you find that the burden on women increasing manifold times, and also the surge in domestic violence, so with the confines of women and other members at home, there is a lot of surveillance happening, and the support system what women had, prior to COVID, all that, whether friend circles or somebody's shoulder whom they could lean on, all that is gone. So, you find even to make a call at a helpline, if a woman is in distress, is, in countries like ours, with the narrow confines of their home, they cannot even make a call. It's easier to say that helpline should be there. But, so the National Commission for Women in India reported that in the month of June, there were some 2,043 complaints, alone largely from city of Delhi, for 1 month, 2,043, which was 8 times more than what it was prior. So it has increased. And some of you might be knowing that in UK, the domestic helpline, 25% increase it has seen in calls. So these are all reported data. And it is showing that, a lot of, misogyny and rampant sexism, substance abuse among men has also been on the increase, due to pandemic.
Yeah, those are some extraordinarily depressing statistics. To add to that, I saw one article in Science News that found that due to increased home duties, and it often seems to be the women and not the men who are taking up all of these additional home duties now that we're all at home instead of going to an office, that they were fewer women were the first authors on articles, on academic articles. So they compared about 1,900 articles published in March and April of 2020 with as compared to the previous year. And they found that authorship by women declined by almost 25%. So it's, you're actually seeing it in terms of output, in terms of how much women are bringing into the labor force. And then, and I think that, all of these numbers you cite regarding domestic violence, that I've seen a lot of them may be underreported just because people are at home and they don't have that freedom and space, as you're saying, Harish, to be able to make those phone calls.
In fact, the UN women called it as a shadow pandemic.
Yeah. Yeah, so it's actually time now. I will stop our conversation and take a couple of the questions from the audience. So the first question is just, well, what comes next? How can we create change how can women create change if women aren't in leadership positions?
I think one of the major takeaway messages I got is that this sort of change in many ways has to come from the bottom up. It has to be in some ways grassroots, because when you look at, for example, the HIV/AIDS pandemic, in many communities, it was the women at the grassroots level who said, we've got to do something. We've got to form committees. We've got to do home health care. We've got to knock on doors. We've got to get food and medicine to the people who need it. And so when women in communities around the world advocate for support for themselves and for each other and for the communities, these women need to be elevated. They need to be empowered. They need to be supported either through the vote or through funding or whatever it takes to make sure that this person's voice is amplified and she is involved in policy development or strategies, or that they're recognized, their contribution to healthcare is recognized.
Yeah. Anything else, Harish, about what comes next and how to get women into leadership positions, or how to create change if they're not in leadership positions?
So I think, the pandemic has brought us an opportunity for largely, men to look at the changing dynamics in terms of gender relations, in understanding the kind of pressures women have to, face at work, at home, so I find, that it's a time for reassessing the gender relations and also, question the traditional notions of masculinity, the toxic masculinity, which is in fact harmful for men also. So I think, this is a time for men to relook and also see that, the yardsticks of performance and, which are being there on them, for over the years, to relook at it and, understand that, also, men also should be able to ventilate their emotions, articulate, whatever they are going through, because this is what they are not told over the years, that, the emotions, even if it is of vulnerability, now many of the men who are jobless, I'm talking about places like India. So, if men, if their role of a provider is being hit, then automatically the displaced anger, the kind of, the stress, the anxiety. So I would say that, men should be at their real self, expressing it, sharing it, taking professional help whenever required. There is nothing, lessening of a man if you take help. So I think those are the things, the pandemic has brought into. So, and most importantly, I think conversations on on gender, masculinity, contemporary happenings, those have to be encouraged. Women have to encourage men in their midst, the close men in their lives, that such conversations are periodically happening, So I think there is a role for everyone to play,
Absolutely. Last question from the audience. What gives you both hope? Have either of you seen examples of changes in gender norms during COVID-19 that you think may stick around?
I think, in fact, the more publicity and the more that the successes of women in who lead countries, the more that they are amplified, the more the message will get across that it's not a threat, that it's a benefit. That again, these voices that have been locked out, allowing them to lead the way and lead the direction is important. And also, there's an organization called Women in Global Health that I would encourage any of our listeners and anybody who's viewing this to check out, because it's been this incredible, dynamic organization with few staffers, but they've been able to use social media, networking, really just, again, elevating and amplifying voices of women who are doing pivotal work in their communities. I think it's just a question of women, and as I said in my article, they are seizing this moment. They are realizing that there's an opportunity to prove and show that their voices need to be at the table.
Mm-hmm. Yeah, absolutely. Women in global health. So everyone note that down. Harish, do you have any examples of changes in gender norms during the pandemic that you think may stick around?
So, with the work I'm doing with young men and adolescent boys, I find that the more you are, triggering conversations with them and, putting examples of, women leaders as well, because they are showing the way in a way, like leaders from New Zealand, from, Germany, I think, men have to stop, listen to these women leaders, see the pointers, what they are talking, and what Rachel was trying to tell, that involve women in the policy making, in the strategizing, so, together we can make a difference. So I think
Yeah.
that sort of attitude needs to be strengthened and percolated to various levels among men. I find, and there are smaller examples, may not be of well-known men, but role models among ordinary young men, who are taking up cudgels and standing up for the rights of women. Those I have seen even during the pandemic, smaller incidents in India, where they are standing up, especially when I work closely with those young men and I'm seeing small incremental changes, in their behavior, in their attitudes. So I think more of that should really happen at a wider level.
Yeah, absolutely. Yeah. So as much as we can showcase these positive examples to show that, I think that I don't want to have this conversation as a monolith that, all men have been refusing to wear masks and refusing to abide by social distancing and are narcissistic, and all women are collaborative. That's absolutely not true. And so I think that showcasing more of these positive examples is really important. Thank you both so much for your time. Before we wrap up, I would love to hear, if the audience is moved to take any action based on this conversation, would you have any calls to action for people?
I would say scrutinize your local, national, state public health organizations and associations and uh, entities that are really delivering service and healthcare, and find out who's running them. And if there aren't women or very few women, make some noise. Make yourself known at the voting box, make yourself known at public meetings, but make sure that you are calling this out, that you're letting people know that you see that more women need to be involved.
Absolutely. That's a great thing that everyone can do. Harish, any call to action from you?
So I would say, like, take a personal stand for the rights of women and, those who are marginalized. I think men should understand, reflecting on the privileges they have been enjoying over the years, the entitlement to power and privilege. So I think if there is a reflection that, a world where we are looking with harmony and peaceful coexistence, there is a need for sensitive, caring men to come forward and take up active stands, and I think that is what I would say, encouraging those conversations, question the dominant masculinity, and, inculcate the culture and vocabulary among men to open up and talk about these issues, which is normally you do not find, between and among men.
Absolutely. Absolutely. Those are such wise words and such good advice. Thank you both so much.
Thank you all. Thank you, Sarika. Thank you, Harish. Thank you, Rachel. We hope you all will consider to take action today to support the important work of these leaders. Please go to aspenhealth.org to find their websites to learn more about the Aspen for All in tomorrow's newsletter. And please be sure to stay in touch, sign up for future conversations, and use the hashtag AspenHealthForAll on social media. Thank you all for a really great conversation.